Namaste. Welcome to Urban Chatterati. This is Abhinav Prakash. And today I have with me Nikhil Mehra, who is a lawyer practicing in Delhi. And today we are going to discuss something very interesting given the politics between the center and the state we are seeing over the crisis management. We are going to discuss what the legal frameworks, what is the division of power, and very importantly, what is the National Disaster Management Act. So, Nikhil, welcome to the show.
Thank you so much, Abhinav. A pleasure being here. I've watched so many of your episodes and I've always enjoyed them. So I'm really glad to be here.
Thank you, Nikhil. And I have been trying to bring you to my show for a very long time. So thanks for giving us time.
Your episodes have been so good. I kept telling you there's nothing worthy I have right now. But finally, we've got a couple of good issues to do.
Thank you, Nikhil. So, Nikhil, let's start with this entire thing. We're seeing the clash between different state governments and the center. Everyone is blaming each other. So, what exactly is the constitutional structure and what is the division of power between the center and the state when it comes to managing pandemic and other things?
Look, let's be clear about certain very simple things. I'm not going to look at the politics, because people will determine politics as they do. I have very strict opinions about how I, as a citizen, would look at how things have unfolded as a voter, which is very different from me as a lawyer. As a lawyer, let me tell you this. There are, and we often hear of this, most of your viewers and listeners would be aware of this. There are three lists in the Constitution. These are the state, they're located in Schedule 7 of the Constitution, and any repugnancy inter se is dealt with Article 254. But what they essentially do is this. They enumerate various heads of commonly understood heads of governance, right? So, national security will fall to the center, for example. Police, we are told, and health in this context falls to the states. And then there is a third list, which is a concurrent list on which both can legislate. State can also legislate. But the moment Parliament legislates, parliamentary law will prevail over state law on matters enumerated in the concurrent list. In other words, on the state list, there can be no parliamentary law. The state is supreme in the state list. How do you determine these legislative heads? These legislative heads are what determine the scope of executive power as well. Your executive power is as far as your legislative power, and the legislative power is trammeled by these various entries. The magic entry in all of this is 97 entries exist for the center, 60 odd for state, 30 odd in the concurrent list. The 97th entry for center says all residuary powers. So whatever else may be something novel that doesn't fit would fall to the center. So that's your state. That's your distribution of power in normal times. Right? Now you have Article 352, which can be an internal emergency. It deals with something called an internal disturbance. Right? So this could technically be an internal disturbance, not be, it's a bit dubious. You have 356, which is commonly used, which is center taking over state powers, administration of a state, which relates to certain procedural requirements that the governor must first comply with prior to the issuance of a proclamation under 356. Right? 355, 356. And then you have obviously national emergency, famous example being what Indira Gandhi had imposed. Right? So this is really how the distribution of powers is. Supposing this pandemic arrives and there is no legislative framework that allows for action between various governments, such that there is still a top-down hierarchy. If the NDMA did not exist, a state government can very easily turn around to the center and say, you may be issuing us certain guidelines, but the nature of the act falls strictly within our powers under list 2. Therefore, we will not comply. Right? This is the problem that a larger framework was supposed to override. Now, obviously, 21st century is not the first time these kind of things have happened. The Brits had these problems as well. But the Brits never really needed any law that would do an overarching power structure for a centralized government, because they had various governor generals in different places, first and foremost, right? So Madras presidency will do what it wants to do, Calcutta presidency will do what it wants to do, Awadh will do what it wants to do, Bombay will do what it wants to do, so on and so forth, right? But they did have the Epidemics Act. This is from 1897. The genuine power under the Epidemic Act, first and foremost, lies with the states. For the states to declare an epidemic, and then to say, that in relation to this epidemic, we are going to take certain steps with a section inserted allowing the central government to issue various notifications, guidelines, or to exercise power in relation to the avoidance of the movement of an epidemic from one state to another. In a very strict interstate movement, that will be curtailed, and that, in very specific regard, is covered by entry 29 of the concurrent list. Right? Now, the tsunami happened in 2004, and the tsunami affected multiple states. It was not a pan-India disaster, but it affected multiple states. And each state was independently dealing with its outcomes from the tsunami, right? So we often hear about how well Tamil Nadu handled things. You know, Jayalalitha was an exceptional administrator at that time. Other states may be less so, whatever it may be, right? But that makes it into a piecemeal response. And if the states now want to turn around to the center and say, look, we need money for X or Y or Z, there is no national framework within which that money comes to you other than your traditional sources of distribution of income. Right? States are also not allowed external borrowing where they will have to provide a security or a collateral. They have to borrow through the center. Right? So to take care of all of this comprehensively, the NDMA was passed. Now, interestingly, the NDMA is eventually passed under, and I'm just going to open the constitution and read out the entry. I had read to you, I'll read to you entry 29 first. This is concurrent list. And it's a very important fact that it is enacted under the concurrent list. Very important, and I'll tell you why. Prevention of the extension from one state to another of infectious or contagious disease or pests affecting men, animals, or plants. This is what I told you, the Epidemics Act, the power of the center to prevent the transference of various epidemics from across states, that power lies from this entry. Right? But you have entry 23, which is social security and social insurance, employment and unemployment. Oddly enough, the NDMA is enacted under this entry. It has never been tested in courts whether certain actions taken in a disaster management situation comport with this entry. What do I mean by that? What I mean by that is when I pass a law, I have a source of power.
NDMA is placed.
The Disaster Management Act. The Disaster Management.
Yeah, is placed in the central list.
No, under the concurrent list.
Under the concurrent list.
Under the concurrent list. Which entry under the concurrent list? The entry which says social security and social insurance, employment and unemployment. Why is it forced to do this? Because there is no entry which says disaster management. Right? Now, when you pass a law and you say that that law fits under a particular entry, then the provisions of that law must relate back to this entry. In the event that the provisions travel beyond the scope of that entry and power is exercised in a manner that is neither covered by this entry nor gratuitously by any other power that the center possesses, whether in its union list or within the concurrent list, then that action is what we call as ultra vires. That's an excessive exercise of power. Right? I have not seen any cases yet that truly test in a live situation whether the NDMA's exercise of powers travel beyond the various entries and the various scope that they possess. Right? So in any event, it is under the concurrent list. Remember what I said, concurrent list means a state can now also pass a law.
Yes.
Provided that law is not repugnant, that is the legal word we use, to the central law. That simply means it should not be contradictory to the central law. And so what you have now is think of it this way. Have you seen those? I mean, we've all seen them in films. I've not seen them in real life either. But those chocolate fountains or those champagne fountains where glasses are arranged top to bottom in a pyramidal structure, and the champagne starts pouring from the top and goes all the way down. Think of this structure in that light, right? The NDMA is like that. At the top is Prime Minister Modi. He is the ex officio head of the National Disaster Management Agency. And there are 9 other members which he picks. Right? From there will be state level agencies as well. To support the NDMA, there is what is called the National Executive Council, the NEC. And the role of the NEC is to ensure that actual execution of various orders takes place.
Okay.
Right? States similarly have their own SDMA, which is a state disaster management agency. So take the example of the floods in Uttarakhand. That is a localized event in a particular state, and disaster management kicks in through the state disaster management agency first. But NDMA would also have the power to start issuing notifications there. Right? That's how the system works. The best part about it, because it is actually, in terms of legal architecture, it's not a bad system at all. So there is national level, then there is state level, but the powers, the act contemplates that the powers and various responsibilities will eventually have to be exercised by the DM, because who is on the ground? You see, union today issues a notification, but union doesn't have enough people in a state, which are its employees, which can enforce its orders. Right? So it is, in a sense, co-opting this machine from the states, right? With specific powers and specific responsibilities to each of them independently, which are not to be randomly determined by the union at its own will. These exist within the framework of the act itself. So the act is really, in certain senses, I think when it was being passed, it was called a marvel of cooperative federalism in that sense. And if you look at it conceptually, if it works well, it is a marvel of cooperative federalism.
When was it passed?
2005, right after the tsunami in 2004, right? Okay. So it was passed in 2005. The thing with cooperative federalism is that when everybody does their work, it's an excellent thing, and when nobody does their work, it's a disaster. But it is equally cooperative in both senses. They're all cooperative with each other, whether in a positive or a negative sense, right? So these were the powers. So a lot of people don't recognize this or realize this, but because the pandemic was first declared a global pandemic by WHO as early as 31st December 2019, or at least not a global pandemic, but was declared to be a potential pandemic as early as 31st December 2019. Obviously, we read stories here in India of how things exploded in Europe and in the US through January and early February. Right? Yeah. So notifications from the NDMA start emerging from the 4th of February. And they're very mild in their statement of that time, right? So I'll read a notification or two to you.
Yeah, so take us till the declaration of lockdown by the Prime Minister Modi. What happened before the lockdown? That's what I'm trying to do.
So 4th February, for example, this is an advisory. It's not even a notification or a directive. It's an advisory that is issued. At this point in time already, so I'm going to now read out verbatim from paragraph 2. While you are aware of the regular meetings being taken by the Cabinet Secretary and decisions taken by the Ministry of Health and Family Welfare through regular video conferences, I am summarizing the important action points which need to be taken up by relevant agencies. So these are of a generic nature. I'll give you a feel for them. Conduct joint review meeting on situational awareness. Obviously, this is an unfolding situation. At this time, you don't even have 100 Indian cases. Right? But it's an unfolding situation. You know the wave is coming. Promote advisories on travel, hygiene, avoiding crowd contact, quarantine of people arriving from other countries notified by MOH, use of personal protective equipment, hand sanitizer, isolation of patients, etc. Now, this is a very important entry, and I want to read this out again. Promote advisories on travel, hygiene, avoiding crowd contact, quarantine of people arriving from countries notified by the Ministry of Health and Family Welfare. These are not specific guidelines as yet. They're of a general import. States are to do, if anybody understands the meaning of the word isolation or quarantine, right? How you do it, whom you want to do it to, this is up to you. We are not at this moment stepping right in and dictating to exactly whom. Yes, the Ministry of Health and Family Welfare, based on its information received, has pinpointed certain nations from which if persons arrive, and this is specifically at that moment in time, China. If persons arrive from there, they have to be tested at the borders, and then they have to be contact traced and quarantined and so on and so forth, right? So at this moment, it is fairly general. And one of the things in anticipation, they say, identify and enhance capacities of isolation facilities in all districts. So they know this is coming, right? Now, on the 5th of March, another one is issued. And now the tone changes And the first change of tone is that this is addressed to all chief secretaries and union territory administrators, right? So this is your nominal executive heads in every state and every union territory, not the political executive, but the nominal executive head, right? You are aware that the number of infections of coronavirus has crossed 95,000 across the globe. We need to gear up the efforts to contain the transmission of the infection. In continuation of my earlier letter, the 4th February letter, which I read to you earlier, I would like to state the following. Your attention is drawn, and now this becomes important. And start thinking of this is the step at which the union is now starting to enter into the foray. Your attention is drawn to the containment plan brought out by the Ministry of Health and Family Welfare with particular reference to cluster containment, which requires identification of containment zone and buffer zone around each epicenter. Right? What does this tell us? First and foremost, the concerned ministry, which is Health and Family Welfare, came out with a containment plan. If you ever hear anybody telling you about India's legal response to COVID, and they are not aware of this containment plan and its details, you can consider them to be a charlatan, because the roadmap was laid down initially by this containment plan, right? So they have a very specific set of guidelines for, and I'll read a bit of this to you as well. Action plan for geographic quarantine, right? Which is a fancy word for lockdown is coming. How will the lockdown be perpetrated? How will it be effected, right? So they had very scientifically set out an idea of a containment zone will have an epicenter and a buffer zone, right? Epicenter is where you identify these particular cases, and the buffer zone is everyone around them. In a very small sense, let's say your building has 20 residents, 2 have COVID, all 18 others are also restricted. They are in a sense the buffer zone. If your entire colony is badly infected, then 3 colonies around you are also infected. Right? But if the larger point is that everybody could potentially be affected, then the whole nation is a buffer zone. Containment zone buffers. Right? That's what happens with the national law. That's what I'm trying to draw towards. So these concepts are now being introduced into our lexicon with these various notifications. Right? So for reading further on the 5th March notification, while you may be aware of the regular meeting, again, same, all states and union territories must step up sensitization trainings for first responders, make people aware of the travel advisory. Still, it's make people aware. Still no ban. There's still no bar. Right? Circulate public hygiene and awareness etiquette as well as do's and don'ts. States should conduct tabletop discussion and exercises on isolation, quarantine, and states should conduct. Bear in mind. Like I was saying, under the NDMA, it's not that the union has enough manpower to go to every state and do all of this. You can't supplant that machinery of the state. You're utilizing the machinery of the state, right? But you have the power of issuing a directive, and this is that directive. Quarantine, infection control, confinement measures, mass screening mechanism, home isolation, amalgamation of public health and law enforcement drills, so on and so forth. It is necessary to issue the directive to avoid public gatherings in confined spaces as much as possible. Mass gatherings may be rescheduled or postponed and held after adequate risk assessment. So for the first time, the center says no more mass gatherings. And there are other elements of this, schools, etc., all shut. You can start talking about schools being shut, etc. In fact, I'm sorry, this particular guideline doesn't speak of schools. It does. Widely propagate strategy of social distancing and personal hygiene awareness campaigns in schools may be started immediately. So schools don't need to be shut right away. A decision on temporary school closures may be taken by the state or union territory administration after risk assessment. Again, the power belongs to the state. Right? Why am I pinpointing these? Because this will change radically in another 2 weeks. Sorry, I couldn't hear you.
No, I'm saying okay.
No, I just okay. Now, if the situation worsens, issue directives on work from home options for major corporates and offices. All international national work related travel must be avoided unless absolutely necessary. Still, these are directives to the states that they can do various aspects of things, right? And so they set up an institutional framework under that containment plan that I told you about. And the institutional framework was at the union government level. The group of ministers under the chairmanship of the union health minister will be the apex body to take policy decisions. Right? So this body has been set up for which this has now been issued. What I was just reading to you. Right? The GOM will have ministers of external affairs, civil aviation, shipping, pharmaceuticals, home ministry, and option for co-opting any other ministry. The Union Health Ministry will have an advisory group that will advise him on way forward. The Public Health Working Group and Joint Monitoring Group under DGHS, the HS will provide technical inputs. At the national level, the Cabinet Secretaries, National Crisis Management Committee, Committee of Secretaries will review the situation across the country and continue to direct the concerned ministries to implement its directions. The coordination with health and non-health sectors will be managed by NCMC, COS on issues flagged by Ministry of Health. The scale of arrangement within the Ministry of Health will be expanded with additional areas among the core capacities assigned to various officers. If need be, there will be empowered groups taking decisions for core areas of work, planning, surveillance, etc. So now you're seeing is centralized power structure evolved for this response. Now, this was a longer, why I read the whole of the union of the union government level institutional mechanism is because now I'm going to read the state level one, which is one sentence. And that once the concerned state will activate State Crisis Management Committee or the State Disaster Management Authority, as the case may be, to manage clusters of COVID-19. You are to now be an implementing body. Right? But the power now, in that first sentence, I'll repeat again, the group of ministers under the chairmanship of the Union Health Minister will be the apex body to take policy decisions.
And this is which date?
This is around 5th March.
5th March. So by the 5th March, the center is assuming control.
Assuming control in the sense that this particular framework is now being put into place. Yes, the center now, if center doesn't issue a particular guideline, doesn't mean the state can't exercise power. Yeah. State can exercise its power. Right? So center hasn't, it has created the institutional framework for exercising that control as and when it needs to, but it hasn't in a broad sense exercised that control, right? So I pinpointed to you this to show that structure is in place, but then I had read to you this letter, which still left plenty in the hands of the states. And this is 5th of March. Now, I don't know how, and 5th March was around Holi, I think, at that time.
Yeah, we had the Holi.
Around 5th March, I think 5th or 7th ki Holi.
I don't recall that, but yeah, in the middle.
3rd, 5th, 7th, something on that sort, right? I remember very clearly, 5th March was also seminal for me because around that time, the courts had issued a directive saying no adverse orders will be passed for non-appearance by advocates. Okay. I had actually stopped going because my parents had told me that this is going to explode. Now there's no point taking a risk. You're not going. Right? And DCs were not in place. So these cases were really basically going by the wayside. And I kept telling them, you know, I'm not going to get any disaster management cash infusion from the union government. I'm dead. Like I'll be dead in a few months. Whatever. So be that as it may, I remember very clearly that 5th March, I pinpoint this anecdote to say that at that moment in time, that sense of heightened crisis is arriving, even though caseload is low still. Right? But bear in mind that at the start of January, we didn't, I don't have the exact source for this statistic, but I've read it several times. But if I'm correct in saying, we had one laboratory in the whole country that could have tested for COVID in January. That got ramped up to over 3,000 of them by July. Oh. Right. So that whole process is now underway, which is different from saying that private players anywhere are also ramping up. Right. So if you have a Dang's lab, Dang has not been testing for COVID, but now they will acquire the ability as well. And they must have been interacting, for example, Dangs or Lals or SRL must be interacting with the state on various counts, saying first, what is the training that is needed? If you recall, I read even in the 4th Feb letter and in the 5th March letter, start these training sessions, right? So this ramping up is happening in anticipation. It actually speaks to a decent level of anticipation, a decent level of response. The problem with what happens in our public discourse is politicians don't give you all of this. And it's a lot of mudslinging, and it's extremely derogatory to the rest of us also because we're smarter than this. We can process this kind of detail. You know, somebody needs to put it out there regularly.
Yeah, agreed. But Nikhil, coming to the lockdown aspect, so we see by the 5th of March, the government is trying to assert, or let's say you are still putting the framework in place. but then this lockdown happened. There's lots of controversy around the lockdown that Prime Minister just came and announced the lockdown. So it was arbitrary. It was like came out of the blue. So what do the
Oh,
notifications tell you?
look. That it came out of the blue uh, is really a matter of communication. It's not a matter of law, right? You will not pass a notification that says a week from now we will have a lockdown. The notification comes after the Prime Minister, because whether to have a lockdown, not have a lockdown, these are momentary things. Like, you move very quickly on these things. So if I recall correctly, the 24th is when the official national lockdown starts, 21-day lockdown starts. But the preceding Friday had been a mock drill in a sense. It had been some sort of lockdown, or just really a request by the Prime Minister that nobody will step out of their houses. Right? So he's setting you up for what is coming. That was a Friday, I distinctly remember. We were banging thalis and doing whatever, but that was a Friday, preceding the Monday on which this lockdown arrived. And then on the 24th, the lockdown actually comes into force. Right? So what I was pointing out to you in this process was just to show to you that things are sort of ramping up institutionally. And now, eventually, on the 24th of March, an order is issued by the Ministry of Home Affairs. Whereas the NDMA is satisfied that the country is threatened with the spread of COVID-19 epidemic, which has already been declared as a pandemic by the WHO, and has considered it necessary to take effective measures to prevent its spread across the country, and that there is a need for consistency in the application and implementation of various measures across the country while ensuring maintenance of essential services and supplies, including health infrastructure. Whereas in exercise of powers under Section 621 of the Disaster Management Act, we have issued an order dated of this same day, 24th March, directing the ministries and departments of Government of India, state union territories, state union territory governments, and state union territory authorities to take effective measures so as to prevent the spread of COVID-19. So now you can see they are assuming that role, saying, now we are talking to all of you. Right? I'm just showing to you from the original constitutional structure, which I showed to you in the beginning, we've now got to that top-down structure as the situation has evolved in the pandemic. Whereas under directions of the aforesaid order and in exercise of powers conferred by Section 10(2)(1) of the Disaster Management Act, the undersigned in his capacity as chairperson, NEC, National Executive Committee, right, hereby issues guidelines as per the annexure to ministries, departments of Government of India, state union territory government, etc. These guidelines are now what are your national lockdown guidelines. Okay, and now what are these national lockdown guidelines that come first up? And that is, so Prime Minister comes on television, announces with a 4-hour gap that there's going to be a lockdown starting the beginning of the 24th. So his address to the nation must have been on the 23rd night at 8 p.m. Right, with a 4-hour gap for the lockdown to come into force. But lockdowns in rule of law systems, lockdowns don't come into force because the Prime Minister has come and said something. There has to be a document that actually details what is this lockdown, right? So that document is consolidated guidelines on the measures to be taken by ministries, departments, etc. for containment of COVID-19 as notified by the ministry on 24/3/2020. And then there are further modifications. So I've got the final document, so it says and further modified on 25/3 and 27/3, because if you'll remember, guidelines came on 24/3 and everybody was like, we're a little bit confused. So one clarification comes on the 25th, and another clarification comes on the 27th. The document I am reading to you now is a consolidated document, right? Offices of the Government of India, its autonomous subordinate offices and public corporations shall remain closed. Right? Absent this particular statement, nobody can close these offices. Now, this comes under the powers under the NDMA 621, Section 6, Subclause 2, Subclause 1. Right? Exceptions being defense, central armed and police forces, right? Which became necessary because China doing what China was doing, and obviously you had police enforcement of lockdowns. Treasury, Public utilities, CNG, LPG, etc., has to keep going. Disaster management and early warning agencies. Obviously, the NDMA can't pass a notification that shuts itself down. So the NDMA has an exception for itself. National Informatics Center. Why? Because you have to keep collecting this data and you have to keep putting this data out on how many cases, so on and so forth. Customs clearance at ports and border. Reserve Bank of India and RBI regulated financial markets. These will stay open. Same exactly for the states, right? Then hospitals, veterinary hospitals, and all related medical establishments, including their manufacturing and distribution units, both in public and private sectors, such as dispensary, etc., will continue to remain functional. Right? Commercial private establishments shall be closed, with certain exceptions, which are like your kirana shops, your banks, power generation, transmission, etc. Right? Industrial establishments will remain closed except for manufacturing essential goods, production units which require continuous process. So for the longest time, iron and steel plants were not required to be shut down, because once you shut that furnace down, it takes a long time to restart that furnace. Right? So they weren't allowed to be required to be shut down. But inevitably, because the lockdown was so severe that there's no workers, there's no demand, it was unprofitable for industrialists to maintain those furnaces, and they were eventually shut down. Those are, unintended consequences, but foreseeable. All transport services will remain suspended. Right? Exceptions: transportation for essential goods only. You get what I'm trying to say. What I'm trying to say here is all educational, training, research, coaching institutions, etc., should remain closed. Congregations, etc., gone. This is the center now stepping in and saying everything shuts down. Right? Why? I have the powers. I have been slowly ramping up from Feb 4th. I have the institutional mechanism. I'm going to be communicating with union territories. These guidelines are issued specifically to those three branches of government, that is national government, state governments, and state authorities. And all of them now have to come together under the singular rubric. And this remains for 21 days and is extended from time to time. Then comes very important notification, which is called Unlock 1. Right? And that is on the 30th of May, 2020. Right? The first thing that this does is phase 1. It's divided into 3 phases. Phase 1, the following activities will be allowed with effect from 8 June 2020. What does this statement mean? It means in relation to these particular activities, whatever was the barring provision in the prior notification now gets lifted. Right? So that bar under lockdown is now gone under Unlock 1 with respect to religious places of worship for public, hotels, restaurants, and other hospitality services, shopping malls, ministry. So essentially, these were all allowed to be open. People may not have exercised those rights, but they were allowed to be open. In phase 2, schools, colleges, educational, training, coaching institutions, etc., based on the feedback, a decision on the reopening these institutions will be taken in the month of July 2020. State governments and union territory administrations may hold consultations at the institutional level with parents and other stakeholders. So now you see that power going back to the state. Now slowly powers start to flow back to the states. Phase 3.
The third phase or from the first phase?
No, this is Unlock 1.
Unlock 1.
Right? Based on assessment of the situation, dates for restarting the following activities will be decided: international air travel, metro rail, cinema halls, gymnasiums, swimming pools, entertainment parks, theaters, etc., social, political, sports, entertainment, academic, cultural, religious functions, and other large social gatherings. Right? So religious places were allowed to be open, means a pujari or a Maulvi, etc., can go there and can keep maintaining it, but you can't have gatherings in it. Right? National directives to continue. Now, the wonderful thing that makes COVID into Amitabh's character Shahenshah makes its entry for the first time in Unlock 1, which is the night curfew. And it says movement of individuals shall remain strictly prohibited between 9 p.m. to 5 a.m. throughout the country except for essential activities. Local authorities shall issue orders in the entire area of their jurisdiction under appropriate provisional law, such as under section 144 CRPC, and ensure strict compliance. Right? what does that second sentence mean? The NDMA sets out a framework. Everybody else has to execute that framework. Right? They say there will be no movement. Now exercise every power that you have to make sure there is no movement. So issue 144 orders, issue whatever other orders you need to do. But that's a state's power. Right? Lockdown limited to containment zones. So at that moment in time, lockdown stayed in containment zones. Containment zones were being clearly defined. I told you they were first defined under that containment plan of the Ministry of Health and Family Welfare. Now, unrestricted movement of persons and goods. This changes dramatically from what was there in the lockdown phase, right? There shall be no restriction on interstate and intrastate movement of persons and goods. No separate permission, approval, e-permit will be required for such movements. If you remember, during lockdown, we had to go meet even someone right next door. We needed a pass. All that pass business was going on online, right? All that goes away now. However, if a state or a union territory, based on reasons of public health and its assessment of the situation, proposes to regulate movement of persons, it will give wide publicity in advance regarding the restrictions to be placed on the movement. So therefore now, this is a very important point. In the lockdown, the union government comes and says nobody will move. Now the union government is saying, as per us you can, it will be a phased manner, but you can. But the state can turn around and tell you you can't.
Okay.
Right? So now, in a larger philosophical sense, this is a restorative power. We're now moving back towards the old sort of normal constitutional framework. Right? And that's unlock 1. Now, unlock 2 arrives. Unlock 2 again reasserts. In areas outside containment zones, all activities will be permitted, except the following, which is schools, colleges, and educational coaching institutions will remain closed till 31st July 2020. So if you look at the last notification, they said you get into consultation with parents and stakeholders, and then come back and we'll decide on school and college reopening in July. Now they say we can't do it in July, right? A part of that was how the science had developed at that time, because there was this huge furor and worry generated by various notifications. I keep saying the word notification, but various press releases of the WHO, which said children can be carriers. Right? The scientific situation is evolving so quickly. Even the people who hate on the government of India vaccine policy today, they're forgetting what the situation was in June, July. I mean, June, July, in reality, some of us didn't believe we're going to see a vaccine for the next maybe a year, maybe a year and a half. We don't know. Right? Maybe we won't see a vaccine at all. Maybe it won't be effective. That kind of thing was going on. And every day there would be a new route by which they say, oh, transmission also happens this way. It also happens that way. We are now in 2021 May, and now you have an article in the Wired which says transmission happens by aerosol. So it's not droplet infection. So it's an evolving situation. So this is what this is dealing with. Now, movement of individuals shall remain strictly prohibited between 10 p.m. to 5. So the Shahenshah curfew remains, and that the central government still imposes. And now the lockdowns, like I said, limited only to the containment zones till 31st July 2020. And the identification of containment zones under the containment plan belongs to the DMs at the local government level and to the state governments. So they are the ones going up to the center saying, okay, this is where there's a lockdown. Fine. So you keep it in place. Like I was saying, containment zones would be demarcated by district authorities after taking into consideration guidelines of MOHFW. Right? So the actual identification of the zone falls on district authority. Guidelines on what should be a containment zone are other broader guidelines in that containment plan that the Ministry of Health and Family Welfare had issued. Only essential activities will be permitted. Activities in the containment zone will be monitored strictly by the state authorities, and guidelines relating to containment measures in these zones shall be strictly implemented. States may also identify buffer zones. I've given you the concept of buffer zone earlier. Outside the containment zone, where new cases are more likely to occur, within buffer zones, restrictions are considered necessary may be put into place by district authorities. So here you can see now it's the state's powers. Extensively now, more and more, the state's power. Identifying which area And it is logical. How can a secretary sitting in the Union of India know which little corner of Andaman needs a lockdown? Can't. Right? So that power is now going logically back to where it ought to have been. And if you remember at that time, within the media and in general public discourse, there was this view that we need a more federalist approach. Now, I understand you need a more federalist approach, but do you understand what was actually happening? Right? So when people say this was not a federal approach, no, it was a completely federal approach. That's one of the things that I'm trying to point out.
That's a very important point you are making, that the government did not assume power.
I'm reading notifications, actual notifications to you, right?
So working within the constitutional framework, and it's basically a federal approach. That's a very important point.
Right. So the point that I'm trying to assert is I am reading actual notifications to you. I'm not giving you opinion.
Yes.
Right. So nobody can tell me that the law didn't exist in the way in which I'm telling you it existed. This was
Facts
the law.
Are in short supply these days, Nikhil.
Right. Again, states' duties based on their assessment of the situation may prohibit certain activities outside the containment zones, by the way, or impose such restrictions as deemed necessary. They could have done it across the whole state if they wanted. Right? So, for example, in Delhi, there was a deferred opening of the metro. Although the metro is permitted to be opened, it's a deferred opening of the metro. Metro doesn't open till September, I think it was September or October, right? State takes the view, by then, if you remember, there used to be certain colonies which were identified as containment zones. X number of cases arise, this lane is a containment zone, that lane is a containment zone, this entire area is a containment zone. But in exercise of this power, state government also says, well, we can't have too many people out and about, so we're not going to open the metro right now. Because the moment we open the metro, the population on the streets will rise. Right? We will keep a limitation on how long markets can be open. All of these things are flexible approaches which the state governments have to identify. The state government has that power. Right? So the others are sort of, now we come to unlock 3. And again, it says schools and colleges to remain shut till 31st of August. So even now they're getting the feedback, you can't reopen this. Cinema halls, swimming pools, entertainment parks, theaters, bars, etc., and similar places will remain closed. Now, yoga institutes and gymnasiums will be allowed to function from 5th August, for which standard operating procedure will be issued by the ministry. And a procedure was issued. So my JMED, for example, sent me a notification saying, look, you can't walk into, whatever footwear you walk into the gym with cannot be used to actually exercise. Small things like that. X number of people will be allowed at a given time, no more than that. You have to carry your own mask, your own water bottle, your own various things, your own towel, and all of that, right? Gloves, and whatever those guidelines were. Metro rail is still not allowed, right? Independence Day functions at national, state, district, subdivision, and panchayat and at-home functions wherever held will be allowed with social distancing and by following other health protocols, example, wearing of masks. So ID day functions are allowed. Lockdown limited to containment zones again. And state have the power to extend various things that they wish to restrict. Now comes unlockdown 4. Except the following, everything else is allowed, which is schools, colleges, etc. are not allowed. But states and union territories may permit up to 50% of teaching and non-teaching staff to be called to the schools at a time for online teaching, telecounseling, and related work in areas outside the containment zones with effect from 21st September 2020. Students of classes 9 to 12 may be permitted to visit their schools in areas outside containment zones only on voluntary basis for taking guidance from their teachers. This will be subject to written consent of their parents, guardians, and will be permitted with effect from 21st September 2020. Skill or entrepreneurship training will be permitted in national skill training institutes. Higher education institutions only for research and postgraduate students and professional programs are shut. These will be permitted by Department of Higher Education in consultation with MHA based on assessment of the situation. Right now, metro rail will be allowed to operate with effect from 7 September 2020. My memory was right; it came in September, in a graded manner by the Ministry of Housing and Urban Affairs. Social, academic, sports, entertainment, cultural, religious, political functions, and other congregations with a ceiling of 100 persons will be permitted. national directives for COVID-19 management to continue, lockdown limited to containment zones. And very importantly, containment zones are only being identified by the state governments. Right. So what does this mean? This means that as the situation improved, and Delhi, for example, was a place which saw around 100 to 150 cases a day for a prolonged period from December onwards. Right? The power now to choose, saying to you, we had covered these various notifications, shown to you that with Unlock 4, more power goes to the states. But I want to make sure that I'm not misunderstood. As long as the center has the power under the Disaster Management Act, with the power comes a responsibility. You know, the great line from Spider-Man, with great power comes great responsibility. It's the same thing. In law, sorry, now I can't hear you.
You are echoing Dhruv Rathi when he made that video saying that Israel and Palestine, with a great power comes great responsibility. So Israel should not go and attack Palestine.
Yeah, so I think what this might be the only time ever I'll be parallel to Dhruv Rathi. I hope. In any event, so unlock is happening. Caseloads are reducing in many places. We've seen national state elections happening in Bihar, where please notice one thing. Whenever I read out notificational provisions pertaining
Elections
to
in Bihar, which election?
state elections in Bihar happened in September, October, November.
Sorry.
Right?
Everything is about Bengal these days. So sorry.
Yeah, no. So what I'm getting at is that particular notification did not say no election rallies to be held. Because whether an election rally is to be held or not to be held is solely the remit of the Election Commission.
Okay.
The Election Commission is what we call as a plenary body when it comes to the administration of elections in this country. Nobody else can exercise a power in relation to an election. Not even the Disaster Management Act. So were the Disaster Management Act to, for example, have a provision that said, and just assume it doesn't possess one provision, but if it were to, that says elections can be suspended by NDMA. That is prima facie grossly unconstitutional in my view. They have no power to say that. Only the EC can issue such rules. So around the Bihar elections, the EC says, let's do a virtual campaign. Opposition parties oppose it. Fair enough, they oppose it. So physical campaign happens. We all saw those amusing WhatsApp videos of people without masks. My favorite one was of a guy who was giving an interview to a local journalist, and the journalist halfway, like after about a 30-second soundbite, says, "Aap mask to pehen lijiye." So another guy gives him a mask and he wears it, and the journalist literally slaps his face and says, "Bhai sahab, aapne apna mask de diya isko kya?" This is how little we cared. Right? This is how far it went. And there were no consequences because cases were not rising. So what I'm coming to is, there is this lull period. You have a new national government that has the power, the state governments that have certain powers. And you now have the public behaving in a particular way. In relation to altering the public's behavior, at least outside of election rallies, the power existed with the state government. This specifically applies to Kumbh, for example, or to any other religious gathering. State government could have said, no, we'll not allow it this year. Right? But cases reduced, people are thinking differently. Similarly, you could have issued such notifications in relation to the farmer protests. Very pertinently, because lockdown arrived, Shaheen Bagh was wrapped up. Shaheen Bagh actually moved, their organizers moved a petition saying our permanent protest spot should not be dismantled entirely. But the Supreme Court didn't sort of accede to that view. No. Be that as it may. So now you have a lull period, but the powers have now moved back towards the states. However, you have the old containment plan that I was telling you about. The containment plan is very comprehensive because it's also dealing with how much testing has to happen, what are the guidelines for testing, who will conduct the testing, how quickly the reports have to come, what is to be done in case of surge capacities. Surge capacities were put into place, right? But these powers now go back to the state. So there is, I have not seen the statistics, but personally haven't seen them, personally haven't verified them, but it was read out by some people in news that various states reduced their surge capacities in relation to COVID because cases had died down. They reduced the surge capacity, right? Now, there's a very interesting article that I read in Swarajya, which is written by Jaggi, which does an analysis, in my opinion, incorrectly and insufficiently, to establish the fact that the second wave came from the farmer protests. Right? For various, I'm not going to go into the merits or demerits of the article. I'm recalling it for particular data points. But he seeks to assert that the second wave came from the farmer protests. His own analysis, in my opinion, doesn't have enough data or enough evidence of that. Right? So be that as it may. But he points to certain very important factors. He says the downward trajectory of the curve, case curve, suddenly started to flatten in early January. And it starts to flatten in Punjab, starts to flatten in a couple of other states, right? And then a slight upward surge starts happening around February. Now, I read to you, all these powers were back to the states. States were not responding immediately, right? But the center has the larger power. It could have very easily gone back. That entire institutional infrastructure that I mentioned to you at the start, that's all still in place, right? Test reports are coming to the center. What have you done in terms of gene sequencing? Have you checked out what is happening to Punjab? Cases are rising. That curve is flattened. What is this version of corona? Is it the same one? Are there more, is there higher infectivity? Are more people dying? Have you done a gene sequencing of which version is this? Because this becomes very important. This is happening in January and February. From the middle of or end of December to March, the UK was hit by one of the worst second waves in the world. Okay, our wave, I'm still telling you, all this idea that Indians are more hardy to the coronavirus, it still holds up. It still holds up given our death numbers, etc. Right? In the UK, over that 3.5-4 month period, there was 70,000 deaths. 70,000 deaths translates to almost 35 lakh deaths for India. If you do a per capita extrapolation, maybe even more, but so be it. So when you're seeing that this is the case explosion in the UK, you are mindful of the fact that early on in the lockdown, I read to you various notifications that said we are going to restrict international travel, right? As early as 4th Feb. We're talking about people coming from certain countries, we're going to contact trace them, right? And there may be some fatigue in the administrative machinery as well. It wasn't doing this as efficient. Well, and by the way, when answer happened, the UK didn't take 2 days to say no more travelers from India. We didn't take this decision. The decision to restrain international travel can only be taken by the center in any circumstance. So it omitted to take that decision, right? And it's a glaring omission. Be that as it may, now the virus possibly arrives in Punjab, arrives in Bombay, in other states from which international travelers are coming.
Yeah.
Right? You have done no gene sequencing to see, is this a different strain? What's going on? What's not? The first we start hearing of a different strain is around March, February, March. End February, March. By then, the spread is massive. It started to surge again. Right? But state governments are still going in different directions. And I'll tell you, as a legal professional, there was no one happier than me when in February, March, the courts were reopened for physical hearing. And I'm not kidding with you. I went to every single court in the city. I don't consider tribunals courts, and with due regard to all my other colleagues who do basically a tribunal practice, I found tribunals to be a very wishy-washy way of getting towards justice. Obviously, they're very powerful, a lot of very effective stuff happens there, but I've never been satisfied by those hearings. I'm talking about courts, meaning traditional courts, meaning trial courts, High Court, Supreme Court. I went to every single one of them when the reopening happened. And multiple days, I conducted meetings with clients, everything, right? This is Delhi in March, early March. And
by this time, they were forcing, in order to show normalcy, in Delhi University and other central universities, they were asking faculty to come to the college and the department and take online classes from the college in order to show
that specific power I showed to you on Lockdown 4.
Yes.
That you can ask professors to come and conduct classes from here, online classes from here, right? Now, as this is happening, and by the way, my luck, I traveled around the city all over the place. I never contracted the virus, right? Just my dumb luck. There's nothing more to it. Plus, people were laughing, if you remember, or mocking and sometimes being, the favorite thing is this is fascism, this is Tughlaqi. This is fascism, this is Tughlaqi. In relation to the Delhi High Court judgment that said, even if you're alone driving in a car, you'll have to wear a mask. Right? And when I was actually doing that driving around the whole place, I realized this makes sense. If I have COVID, right, what was the logic of that judgment? You are a private space, no doubt, within a vehicle, but you're moving through public spaces and you're interacting intimately with public spaces, right? So if I have COVID and I'm not wearing a mask, I am obviously spewing droplets. At this moment in time, we're still thinking droplet infection, by the way, right? At various public places, I may lower my window. Just I'm at a red light, some beggar comes, I feel bad, I want to give him some money. And I can spread the infection back. Right? So we have these two parallel things going on. On the one side now, various state governments are opening up. Central government, in my view, has decided it's all over. We've got Bengal to fight, we've got other things to do. There may be case rise in Punjab, but we don't know. ICMR has done no gene sequencing. We don't know what strain it is, what it isn't. And suddenly in March, late February, March, we're like, oh, every kind of strain is right. And in only late March, early April, do I start seeing articles in the media saying 80% of all infected cases in Punjab were the UK strain, and 50% of all cases emerging in Delhi at that time were the UK strain. So there's a 3.5 month period where everybody dropped the ball, right? But the buck stops with the center. Again, I'm coming back to that institutional framework was set up for your powers, for your oversight, right? The finest scientific facilities exist in your control, your power, right? Besides which, there is oxygen procurement and various other things. In relation to oxygen procurement, I'll tell you, in the containment plan, there's a very clear instruction that as and when various vehicles need to be mobilized, they will be mobilized through various to various government departments. Right? What am I referring to? Large tankers and these cryogenic tankers, etc., that need to be moved to transport oxygen. Have you done an oxygen audit in October, November, December, January? Have you done any such audits? What are your requirements? What are they not? Right? Have you determined, and let me put it this way, had you determined, as was evident in the UK, that with that strain, oxygen collapses. Even people who recover first need ventilator support. And if you look at the containment plan, there was an estimation in the containment plan that around 15% people will need hospitalization and around 5% will need ventilator support. Maybe those numbers change now with this strain. Right? So in the UK, if you're seeing this kind of, 70,000 dead in the UK means there'll be entire villages and communities wiped out of it. There's small communities. It's a nation of 20, 30 million. So you took your eye off on that altogether. You don't have an idea about the oxygen situation. You can't, for example, I was discussing this with another common friend of ours. I won't name because, shouldn't name people generally, but that had you had a wiser containment plan, you could have thought, okay, there will be a category of cases that need intrusive ventilation or a ventilator at a high volume of oxygen versus those who can be dealt with at home, right? Along with the vaccine plan moving forward. You could have made a provision within the states that there will be a centralized zone from which you can pick up oxygen tankers for your home, oxygen tanks for your home, right? So a lot of cases can be dealt with at home, or at least their admission into hospitals can be deferred, or at the very least, people are not running pillar to post saying, "Meko kisi hospital mein kahin pe kuch to admission de." And in doing that, contracting COVID themselves.
Yeah.
Right? No single advisory. From the middle of that surge in the UK around February, clear data-driven, peer-reviewed scientific articles that plasma caused the mutation. Administering plasma caused the mutation. Till yesterday, when the government of Tamil Nadu finally issued a line of treatment that excluded plasma, remdesivir, ivermectin, hydroxychloroquine, all four excluded. Not a single Indian government had come forward and said plasma should not be administered. People are running left, right, and center trying to find plasma, trying to find remdesivir. This despite the fact that for weeks now, I've been sharing videos on Twitter of Dr. Randeep Guleria coming on television and saying, look, plasma is useless. Remdesivir mistimed is useless. Ivermectin is useless. Hydroxychloroquine is useless. Or if these have to be administered, they have to be administered at the right time. Steroids, very dangerous. I know of cases where steroids were administered too early in the treatment phase, and the steroids have caused 70% lung damage.
You know, what is happening? First of all, it's difficult to say, but many doctors in the private hospitals are in nexus with the suppliers. It's happening because you have many raids conducted.
Here's a very simple thing I'll tell you. You know, when we speak of people like you and I, we are wedded to the idea of the spontaneous order in economics, right? And it's a great thing to have. But this is a different situation. Why? Because here there's a scarcity of goods at a level at which it never exists otherwise. Right? Everybody needs the same goods. Whether it is a hospital bed or a ventilator or an oxygen tank or remdesivir or plasma, whatever it may be, everybody needs the same sort of goods. Right? This is why I say if the state were present in the distribution of these goods, in the collation and distribution of these goods, then the state would be aware of these nexuses. It could have evaluated. Look, very simple. Delhi state government comes periodically and says, oh, oxygen, we need 700 megatons. All right, fine. 700 metric tons. All right. So state government, so for the longest time, the union government puts out a metric. You know what this metric was? Well, this is something very important. I want to go through this. So this is factually very important. Take two cities, Bombay and Delhi. As the narrative stands today, Bombay has handled it professionally. Delhi has been a disaster. Okay. I promise you, if you look at their case graphs, they're following exactly the same path. Whether it is good management or bad management, exactly the same path, just that they're about 15 days apart or 10 days apart. Right? So Delhi now has fallen below 6,000 cases a day. Bombay has now gone to 3,000, to 2.5 to 3,000 cases a day. From the same peaks that we were at. So Bombay was being praised to the skies because it had brought it down to 5,000, 6,000, 3,000 when Delhi was still up at 21,000. That 21,000 went to 17, 15, 11 so quickly.
Yeah.
Right? And as someone who has been constantly trying to put people in touch with COVID resources, I can tell you, requests have disappeared virtually. Requests are now coming for UP. They're coming for other states, but Delhi वगैरह में खत्म हो गया. So wave था एक वो आया वो चला गया. How much is self? See, people want to have this belief that we could have controlled things. Well, there are things we could have controlled, things we could not have controlled, and even if we could not have controlled them, there are things we had to do. And who tells us we had to do them? Exactly your containment plans, exactly your notifications.
Yes.
You set this precedent.
Yeah. So Nikhil,
let me continue on this, please.
Yeah.
The Bombay Municipal Corporation set up an oxygen protocol. They said, we will demand oxygen at the rate of 5 liters per minute of oxygen per non-ICU bed and 20 liters per minute of oxygen for each ICU bed. The national level protocol that was set up, which is set up by a committee of experts, was we are going to assess the state's need for oxygen at 10 liters per minute per non-ICU bed, which is double of what Bombay got. Bombay assessed for itself, and 24 per liter per minute for ICU beds, which is again higher than what Bombay wanted. Right? And if I do that calculation, this is what the SG submitted in the Delhi High Court. If I do that calculation, Delhi's requirements are 415.7 metric tons per day. So where is this figure of 700 coming? Right? Delhi High Court is now, see, the way of proceeding is conducted a very dangerous thing. Writs are therefore very dangerous thing. And at some day, we're going to sit down and do a podcast on the flaws of writ jurisdiction qua factual jurisdiction, which is trial jurisdiction. Why you cannot remove trials and hope to do everything by writ, because then it becomes guesswork. Anyway, it's a different matter. But what I'm getting at is, you have a hearing in which 70 hospitals have filed pleadments. They're all coming and saying, same submission. I have no oxygen. What am I going to do? In 3 hours, I'll be gone. I have been making requests to the Delhi government. Delhi government people don't turn around and make requests to the central government. Central government is not able to deliver to me. Oh, there's no tank. Oh, there's no this. Delhi High Court says, boss, you will deliver 700 empty for sure. Otherwise, we're going to issue contempt. Next morning, SLP gets filed. In the SLP, Union government takes a very interesting strategy. It says, we are going to supply 700 today, tomorrow, day after. But please order an oxygen audit. Suddenly the demand disappears.
So what was happening?
What am I trying to point out? I can't know what was happening. You can't know what was happening. We can guess. What's the point of guessing? You need facts. But the state doesn't know what was happening because the state is absent from this entire exercise. And all of these demands for oxygen do not take into account the oxygen necessities of people who are filling tanks at home, or using oxygen concentrators at home. And now we are chasing people down saying, you're a black marketer, an oxygen concentrator. Why are you a black marketer?
That's a very stupid thing, actually.
Beyond absurd, right? This is the state covering up for its own. And when I use the word state, I don't mean an union government was a state government. I mean the state as a political science concept. It is the state covering up for its total and complete breakdown in a COVID response from January onwards. So the first half of what I was telling you was, all the structure is built. All of it, the institutional structure is built. Everything's in place. What did you do after that? We all understand this surge was a massive, monumental surge, right? You go from 1,500 metric tons capacity for hospital use oxygen in a day to 9,000 metric tons in a matter of no time. But when do you do it? You do it after lives are starting to get lost at an alarming rate. That's a dereliction of duty in my book. Right? And I'll tell you something, all this analysis I am capable of doing because I'm a lawyer. I will read notifications. I will go into all the depths of all of this stuff. That's fine. If I'm as a voter, I don't care. As a voter, I have a very simple principle. First wave may, from symptoms to hospitalization and to an unfortunate death, I had a number to call. I had somebody looking out for me. The state was present. In the second wave, from the moment I get symptoms, there's nothing. Nobody is present. There's no system.
The state.
I speak of Delhi in that regard, in particular. I'm told Bombay was not like that. I'm told Bombay is not like that. I'm told Tamil Nadu is not like that. I don't know what's happening in UP, but I'm talking about Delhi in particular. Right? So it's not just Kejriwal. I would look to the central government and say, what the hell were you doing? Because these systems, you had both the duty and the power by virtue of the NDMA to put into place. You can't now in your social media blitzes turn around and say, in 6 meetings, the Prime Minister has told various state governments, oh, there's a surge in your state. So what the hell are you doing, buddy? You have the power, do you not?
So it's basically cooperative federalism turning into cooperative disaster.
That's what I told you at the start, right? It's cooperative federalism. It remains cooperative federalism in both glory and disaster. They copied each other.
Fine. That's a very interesting thing, Nikhil. Thank you for giving such a detailed description of the legal frameworks, mechanism, because people don't know about these things and they need to hear these things, because as in India, our level of public discourse is so low. Look at the opposition leader, BJP ki vaccine, iski vaccine, and now hamari vaccine bahar kyun bhej di, hamari vaccine bachchon ki vaccine, all kind of low level discourse. Just switch off the television and watch my podcast.
Yeah, I don't know. I totally agree with that.
Okay, so thank you, Nikhil, for coming, and thank you, audience, for listening to us.
Abhinav, thank you so much.
And don't forget to subscribe and join as the member. See you soon.